We really love working for the RFDS. It's a really lovely organisation. We've felt really welcome from the very start, and also it's an organisation that you can see the impact it has on the community. Like, it's really amazing actually. We've just spent a couple of weeks just around New South Wales, and whenever we tell anyone what we do for a job, just the gratitude that the community has for working for the RFDS is really amazing.
My role, I run a lot of wellbeing programs and activities within schools and communities. There's definitely some very distinct moments that stick in my mind over the years where the joy in the classroom has just been so palpable amongst students and staff that, yeah, I've just thought, there's just no better place to be right now. So
I love working for the RFDS. It feels like my family out here. We provide great services, great opportunities, and I love helping people.
We always learn that healthcare is difficult for patients who are living in remote areas, but once you're out here and you see it, you really get a good feeling that it is difficult for them to access the healthcare that they require. It's a long way to go to the GP. It's a long, long way for tests. It's a long way for any healthcare they need. And what I've learned is strategies for overcoming these difficulties and how to help the patient access the care that they need.
I think it's really important for the RFDS to have, alcohol and other drug workers, clinicians, because there's just so many people out there that need our help and support, and for them to come into a service, it's really huge. And to have some of our AOD clinicians just waiting for them or just calling them on the phone, our people, our clients, or whatever you want to call them, they're just so important. It's about them.
I never thought I could work here because I'm not a nurse and I'm not a doctor. So I never thought that anything that I did, I would be able to do here. But I can. I do administration, and yeah, it's great.
Here, the community, the team, the importance of the job that you're doing is what makes your day, really, and that's the incredible part of it.
I think also you never know what your day's going to bring. You can have some idea, but and then the day comes and then it completely goes 360. Sometimes I'm like, oh, okay, we're going to go to Adelaide, and all of a sudden oh no, you're going to go up the corner country, or you're going to Beverly Mine, or you're doing something different that you don't expect. So I think that's it. And we have such a good team, it's always fun. I think, we're all very close, the pilots, the doctors, the nurses. There's a lot of banter, so it's always a fun place to work.
I've always considered myself to be a kind, caring and empathetic person. I have learned more so about working along communities and people who are underrepresented and underprivileged. I have learned more of those traits and how to develop them, and I have grown in those areas.
The best part of my day is working with the people out in the community and our staff that work in these communities, because we make friendships, really, because we're seeing them on a regular basis where, so it means so much to me, the communities and the staff working together.
RFDS is such an amazing organisation. What we do Australia-wide, and we can take to rural and remote communities. It's 1 in a million.
It's the kind of work that we get to do. We've had the opportunity to really look after some really, really sick people that, by virtue of how isolated they are, their condition is sort of made 10 times worse. And when we get to fly in and be that difference, be that link that connects them to the care that they need, there's nothing like it. You really do feel like you've earned your worth in the job, and you've made a difference to somebody's life, which can get forgotten sometimes, but not out here.
My scope of practice has expanded greatly since working in the primary healthcare clinics. It's a great learning environment, working with some really skilled, knowledgeable clinicians that has opened up my eyes to how far my practice can expand in primary health.
Best part of my day, I guess, is the fact that I have autonomy and I have control over my workload to a degree. So yeah, just being able to come in and the good teamwork that in the environment that I work in is really important. And I think just having a certain amount of autonomy and being respected is also really good.
I think working with the pilot, working with the community, building that rapport with the community, patients and different hospitals and clinics, I think that's a beautiful thing, and coming together as a team.
The organisation is just amazing. They're always there to support you, they're always there to help you, they encourage you to do further education, they are always there for you. It's one of the most magical places I've ever worked at.
It's a lot of fun just getting up out into the air, going to new different places that you haven't been before, remote places, dirt landing strips with a really great team of a nurse and a pilot, and doing some really interesting medicine.
Yeah, it feels real good, and working with the organisation that put family first, and they've got the values of safe, reliability, trust and care. That really talks to what the organisation provides in community, but also what they do with their workforce. That's made them a 98-year long history in Australia.